is Dr. Kwasa, a radiologist at Stratus Medical, partnering with Ponea Health. Today we'll look at precautionary measures taken to make sure you are safe when imaging is being applied. So what are the precautionary measures that we take? Again, it depends on your particular clinical case, the imaging modality requested, and the contraindications, whether absolute or relative, in that space. So we will go through this again in a classified way. So we are looking at ionizing radiation versus non-ionizing radiation. In ionizing radiation procedures, the main concern is exposure to radiation that may lead to cellular injury. This particularly affects children and women of childbearing age. So for women of childbearing age, we want to know, are you pregnant? And can we be sure that you're not pregnant? Why? We are worried about the radiation effect to the unborn child. And so this may take the shape of trying to understand the last menstrual period, or to understand if there's any contraceptive use that's in place, or indeed a pregnancy test if that is necessary. For children, we want to know how old they are, what the imaging modality is, and whether or not this imaging modality is relevant to the clinical question, and if there is an alternative method to do this that has less radiation exposure. Now, when we look at non-ionizing radiation, ultrasound is largely safe. The main concern we have is MRI. And what is the concern with MRI? Very powerful magnet, which has the potential to move metallic objects and disable the function of electronic equipment. So part of the precautionary measure is, number one, to have a questionnaire. Find out, have you in your life been in a war area, involved in wartime activities, or been involved in a bomb blast or any other violent event with explosives? Have you had any metallic implants put in or swallowed a foreign body? Have you worked in the welding industry? And do you have any electronic devices implanted, mainly pacemakers, insulin pumps, and the like? And if that is the case, then we would have to steer you away from the MRI, simply because of the risk. Now, it is not everyone who's had a metallic device implanted that cannot go into an MRI. For example, if someone had a hip replacement, but they need an MRI of the brain, as long as the hip replacement was MR compatible, which means titanium and a few other agents out there, then it is safe to have an MRI. But it is critical for us to know which implant do you have, when was it put in, and if possible, what kind of material was used, just to make sure that you're safe. So this is an example of the precautionary measures we take. This is not an exhaustive list, but it should hopefully help you understand that we are looking out for your safety when you're having imaging done, and we can find alternatives to get to the right answer without exposing you to unnecessary risk. Thank you for joining us for this discussion. You can book our services on ponea.com. You'll be able to visit us here at Stratus Medical. Feel free to join us again as we'll engage more in understanding how does imaging affect your life and your healthcare experience. Have a good day.